Timmy Keywell first became a mom back in 2018. While she was supposed to be enjoying time with her new baby, a few months after giving birth, she started having symptoms that concerned her.
I was having copious amounts of blood when I would go to the bathroom. I just had a baby, so I knew it wasn't hemorrhoids. I had been Googling my symptoms the whole time, and everything that came up was colon cancer. And I was like, no, there's no way. I'm only 31. There's no way I have cancer.
She eventually went to see her primary doctor, who then scheduled her for a colonoscopy a couple days later.
She had a fairly sizable, partially obstructing sigmoid colon tumor, a growth involving the sigmoid colon, which is in the left side of the colon.
I remember the look on Dr. Hurley's face when I was coming out of the anesthesia and he was explaining that they had found that large tumor to my husband, and I knew it wasn't good. My husband was there with me. They told us they found a tumor, that I needed to get a CAT scan.
Usually a colon cancer is diagnosed by a colonoscopy, and the endoscopist takes a biopsy during the colonoscopy, and then the pathologist determines that does in fact or is in fact compatible with a colon cancer. So that's what happened for her, and then patients undergo some staging evaluation, which in the case of colon cancer includes a CAT scan. That looking clean for her, she went to surgery to have the colon cancer removed.
Keywell had about 12 inches of her colon removed.
After a period of recovery, which usually, is about 4 to 8, sometimes up to 12 weeks, depending on if there are any kind of delayed healing issues, then a patient can start chemotherapy.
I came in for 12 rounds of chemo. It took place over the course of 6 months, and I did 12 rounds, and it was awful.
While that was tough, she's thankful for the care she received from the team at Avera.
Now I just got to graduate to scans every 1 year. So I think it was on the 27th of February was my 4-year anniversary of ringing the bell.
Keywell's case is uncommon due to her age. It's recommended to schedule a screening starting at age 45.
31 is a very young age for colon cancer. Unfortunately, I've seen colon cancer in patients in their 20s. That's very, very unusual, but we are seeing, and that's one of the reasons the age for screening decreased from age 50 to age 45 is because there's an increasing incidence of colon cancer being diagnosed in younger individuals.
Now, Keywell hopes that her story will encourage others to take the time to schedule their own screening.
Colon cancer is one of the most treatable cancers if it's caught early. And to catch it early, all you have to do is go get that colonoscopy.
With Avera Health, I'm Jake Iverson.